Imagine walking into a doctor's office only to discover that an invisible algorithm decides whether you get the treatment you need. That's exactly the pilot program Medicare is rolling out next year. And it's stirring up serious debate. But here's where it gets controversial. This initiative lifts a private insurance tactic known as prior authorization straight into traditional Medicare, a system that's largely avoided it until now. And this is the part most people miss. An AI brain, not just human reviewers, will steer the approvals, drawing from methods routinely used by private insurers, especially in Medicare Advantage plans. The Trump administration has launched WISER, Wasteful and Inappropriate Service Reduction, beginning January 1st and running through 2031 in Arizona, Ohio, Oklahoma, New Jersey, Texas, and Washington. WISER uses AI to screen certain Medicare-covered services. Targeted procedures include skin and tissue substitutes, electrical nerve stimulators, and knee arthroscopies, those deemed prone to fraud, waste, and abuse. If the algorithm flags a service, a human clinician steps in, but only after the machine has rendered its initial verdict. Prior authorization requires patients or their care teams to get insurance approval before tests, prescriptions, or procedures. Critics argue it drags out care, sometimes causing irreversible harm or even death. Patients, doctors, members of Congress, and policy researchers have slammed the tactic as a delay or deny scheme. Dr. Greg Murphy, a urologist and North Carolina congressman, puts it bluntly. Insurers take patients' money and then do their damnedest to deny giving it to the people who deliver care. Yet insurers defend prior authorization, arguing it's a vital barrier against unnecessary spending and dangerous, unproven treatments. They claim AI further cuts through human bias and speeds decisions, though evidence is mixed. A 2023 ProPublica report revealed that Cigna reviewers spent an average of just 1.2 seconds per case. And a February survey by the American Medical Association found 61% of physicians believe AI is actually driving up denials and patient harm. But the timing of WISER raised eyebrows. Days before its June unveiling, the administration celebrated a voluntary pledge from private insurers to trim back their own prior authorization use. CMS Administrator Dr. Mehmet Oz went so far as to say the delays erode public trust and can't be tolerated. Yet here comes Medicare, embracing the very tool the administration publicly vowed to curb. Critics smell mixed messages. Dr. Vinay Jaffe of Ohio State University points out that while the government loudly admonishes private insurers for overusing prior authorization, it quietly adopts the same cost-cutting methods for its flagship program. They're talking out of both sides of their mouth, says Representative Susan DelBene, a Washington Democrat, who joined others in writing to CMS, seeking clarity on how the pilot will be monitored and evaluated. CMS insists WISER comes with built-in safeguards. No denial happens without a qualified human clinician's review. And vendors, those running the AI, cannot be paid based on denial rates. They will earn a share of savings only when care is appropriately reduced. Yet some worry these shared savings arrangements create subtle pressure to cut approvals. Jennifer Brackeen of the Washington State Hospital Association cautions that financial incentives, no matter how regulated, can steer decisions away from patients' best interests. The pilot also exempts inpatient-only, emergency, or high-risk services that cannot be delayed. But beyond these carve-outs, details remain thin. How will Medicare truly measure whether the algorithm helps or hurts patients? Who verifies the model's fairness and accuracy? Georgetown's Amy Kilalia warns that the phrase meaningful human review is alarmingly vague, leaving open the possibility that AI could dominate the process. On the Hill, concern crosses party lines. Republicans and Democrats alike question how WISER will perform and whether it infringes on physicians' clinical judgment. Representative Lois Frankel recently championed a budget amendment to halt funding for the pilot in 2026, Meanwhile, Murphy admits he's hopeful AI can streamline bureaucracy, but vows to side with doctors' expertise if conflicts arise. "I will always err on the side that doctors know what's best for their patients," he says. Proponents argue this is exactly the kind of innovation Medicare needs to rein in skyrocketing costs without compromising care. Educational webinars and FAQs will accompany the rollout, and CMS promises ongoing transparency reports. Still, experts like Professor Jennifer Oliva at Indiana University warn that algorithms often target expensive interventions. She points out a chilling dynamic. When a patient's life expectancy is short, insurers, knowing appeals can drag on, may effectively bypass coverage by outlasting the patient. So what happens when government programs start relying on machines as gatekeepers? Will AI bring Medicare into the future, saving billions and protecting patients from unnecessary procedures? Or will it deepen a regulatory blind spot, shunting high-value care aside in favor of the bottom line? The wiser pilot stands at that crossroads. Now it's your turn. Do you trust AI to help decide your medical care? Or do you fear this is just another layer of denial wrapped in technological hype? Let us know your thoughts. Agree, disagree, or raise more questions right here in the comments.